Welcome. My name is Dr. Robert Gish, and I am a hepatologist and an adjunct clinical professor of medicine at the University of Nevada in Las Vegas, and an adjunct professor of medicine at Stanford University. As healthcare professionals, we rely on vaccines to help protect our patients and ourselves from the diseases they prevent. But what if I told you that there is a vaccine-preventable disease that is actually on the rise, posing a major public health challenge? A disease that can lead to chronic infection and serious complications and even death. That disease is hepatitis B. Hepatitis B is on the rise, and healthcare professionals may be at increased risk for exposure. According to the CDC and the Hepatitis B Foundation, 12 million Americans have been infected with hepatitis B virus, and 850,000 to 2.2 million are living with chronic infection. And if you look at some of the states affected by the opioid and heroin epidemics, hepatitis B infections increased even more dramatically, up to 114% from 2006 to 2013, according to the CDC. Let's look at what makes hepatitis B such a threat. The virus that causes hepatitis B is highly infectious, 100 times more infectious than HIV. Each year, healthcare professionals sustain up to 800,000 needle sticks and splashes that can expose them to infection, and there is an up to 62% average risk of hepatitis B infection after a needle stick or cut exposure to infected blood. The virus is also highly resilient and environmentally stable, remaining infectious outside the body for up to 7 days. This means it is transmissible even in the absence of blood in common items or places in the healthcare environment, such as surgical or other healthcare tools, counters, and other surfaces, papers handled by laboratory employees, and medication vials shared in dialysis units can be sources of infection. In fact, hepatitis B is often referred to as a silent threat because most infected carriers remain asymptomatic and unaware of their disease or their risk for transmitting the virus to others. Once the virus is transmitted, a hepatitis B infection can progress to chronic infection, which can lead to serious complications and death. Chronic hepatitis B infection causes nearly 15% of cirrhosis diagnoses and up to 50% of hepatocellular carcinomas in the U.S. Up to 5,500 hepatitis B-related deaths are estimated to occur each year in the U.S. Yet, as many as 1 out of 3 healthcare professionals who initiate a vaccine series are not protected. 3-dose vaccines require 6 months to complete. However, only 64.7% of healthcare professionals completed a hepatitis B vaccine within 1 year. Even among healthcare professionals who do complete a 3-dose hepatitis B vaccine series, up to 21% do not develop immunity. An important update to the hepatitis B vaccine landscape arrived in November of 2017 when the FDA approved Heplisav-B, making it the first hepatitis B vaccine approved in over 25 years, and the only 2-dose hepatitis B vaccine for adults. Heplisav-B has also been unanimously recommended by the Advisory Committee on Immunization Practices for the Prevention of Hepatitis B in Adults. Heplisav-B offers fewer doses in less time, just 2 doses in 1 month compared with 3 doses in 6 months of other hepatitis B vaccines. Let's look at the data. In 3 pivotal clinical trials, Heplisav-B protected more adults with just 2 doses in 1 month than 3 doses with Engerix-B, with protection defined as the presence of serum antibodies. Also, Heplisav-B consistently protected more than 90% of adult patients. In Trial 1, 2 doses of Heplisav-B provided earlier and higher rates of protective immunity than 3 doses of Engerix-B in patients aged from 18 to 55. As we just discussed, only 64 0.7% of healthcare professionals who initiated a 3-dose hepatitis B vaccination completed a full series within 1 year. That means that nearly 2/3 of these healthcare professionals are only receiving 2 doses or fewer. Consider what this means for the percentage of healthcare professionals who are achieving protection from their hepatitis B vaccination. In Trial 2, with 2 doses in 1 month, Hepatitis-B provided higher rates of protection than 3 doses of Engerix-B in patients 40 to 70 years old. Once again, consider the rates of protection for Hepatitis-B and Engerix-B after just 2 doses in view of what we know about real-world compliance to the vaccine series, and whether a 2-dose vaccine that provides early protective immunity may be of clinical importance. In Trial 3, adult patients with factors that typically affect immune response and negatively impact development of protective immunity, including those with diabetes, age 40 to 70, male gender, obesity, and smokers, were evaluated. Hepatitis-B provided higher rates of seroprotection than Engerix-B in these patient groups, who now have the potential to achieve higher rates of protective immunity with 2 doses of Hepatitis-B than with 3 doses of Engerix-B. Let's now review the Hepatitis-B safety profile, which has been demonstrated in the largest database of clinical trials for hepatitis B vaccine. Over 10,000 adults and counting, and up to 1 year of follow-up. The most common local reaction was injection site pain, 23% to 39%, and the most common systemic reactions were fatigue, 11% to 17%, and headache, 8% to 17%. Percentage of patients with an unsolicited adverse event was comparable between Hepatitis-B and Engerix-B in the 3 trials. With its 2-dose and 1-month regimen and higher rates of protection in 3 trials versus Engerix-B, Hepatitis-B is an important addition to hepatitis B prevention. With millions of adults, including healthcare professionals, in need of protection against hepatitis B and rising incidence of infection, it is time to increase our awareness of hepatitis B protection. Together, we can take a stand against hepatitis B to reverse the rising trend and help eradicate this vaccine-preventable disease once and for all.
Hepatitis-B is indicated for prevention of infection caused by all known subtypes of hepatitis B virus in adults 18 years of age and older. Do not administer Hepatitis-B to individuals with a history of severe allergic reaction, for example anaphylaxis, after a previous dose of any hepatitis B vaccine or to any component of Hepatitis-B, including yeast. Appropriate medical treatment and supervision must be available to manage possible anaphylactic reactions following administration of Hepatitis-B. Immunocompromised persons, including individuals receiving immunosuppressant therapy, may have a diminished immune response to Hepatitis-B. Hepatitis B has a long incubation period. Hepatitis-B may not prevent hepatitis B infection in individuals who have an unrecognized hepatitis B infection at the time of vaccine administration. The most common patient-reported adverse reactions reported within 7 days of vaccination were injection site pain, 23% to 39%, fatigue, 11% to 17%, and headache, 8% to 17%. Please see full prescribing information at hepatitisb.com.